Good afternoon, everyone. I'm Bill Schmidt, President and CEO of the Pulmonary Fibrosis Foundation. Welcome to our Fireside chat, where you will meet PFF's outstanding medical team and learn more about their backgrounds and interests. And we have a very special guest who will join us, so be sure to stay tuned. But first, I want to share highlights of the PFF's new strategic plan covering the next 3 years. I hope you're all enjoying the PFF Summit. On behalf of the PFF Board of Directors and all my staff colleagues, I am pleased to present to you highlights of the new PFF strategic plan. Entitled Accelerating the Pace of Progress, Pulmonary Fibrosis Foundation 2024 Strategic Plan. It's a blueprint for improving the lives of people with pulmonary fibrosis and moving this field of research forward faster over the next 3 years. Today, I am previewing the key elements of the plan. The full plan will be formally released in digital format on our website on November 10th. I want to thank the entire PF community for the long-standing support necessary to develop this plan, and that also got us to where we are today. Patients with PF and their stories inspire us literally every day, and their needs are at the center of every element of this plan. Since the creation of our current and first strategic plan 5 years ago, this community and the PFF have accomplished a lot together. I want to share a few highlights. We built the PFF registry, an important research tool that enrolled over 2,000 PF patients in just over 2 years. Already, nearly 40 studies are underway utilizing its valuable data and samples, and we hope this is just the beginning. The registry is a critical component of a $22 million National Heart, Lung, and Blood Institute clinical trial, one of the largest single public investments in PF research ever. We expanded the PFF Care Center network from the original group of 9 centers to over 68 today. We have dramatically expanded our educational offerings, including a video series, webinars, and our PFF Help Center. The number of PFF support groups has grown from 88 to over 150 today. And we were involved in launching the Prolific Consortium, a collaborative effort by leading companies and foundations to develop and validate tests that can identify biomarkers to speed research and shorten the time to diagnosis. New programs created over the past 5 years include our National Walk program and our government advocacy program. Turning to our new plan, we felt very strongly that it was important to gather input from a broad cross-section of the PF community to inform our future direction. We convened 4 stakeholder groups, which are listed here. There were 2 professionally facilitated discussions with each of these groups, and we received many good ideas and perspectives, as you can imagine. I want to thank everyone who participated in those conversations. We also received extensive input from an internal strategic planning steering committee comprised of board members and staff, as well as our medical and scientific advisory committee and our incredible group of medical advisors from leading institutions across the country. The feedback we got from this group was also extremely valuable. We felt it was important to make a clear and concise statement that encompasses our guiding vision for the future of the PF effort. This vision has existed since this organization was started in 2000, but our goal here was to make it even more explicit and visible. This entire plan is about moving toward this profound vision of the future, a world without pulmonary fibrosis. We also took this opportunity to revise and update our mission statement. Our goal here was to simplify and make clearer what the mission of the PFF is going forward. It aligns with the major strategic goals of this plan, which I will address shortly. Also, for the first time, we developed a statement of values for the PFF. These values will guide the work and culture of the PFF into the future. The PFF is strongly committed to diversity, equity, and inclusion in conducting our work. We want everyone who is affected by pulmonary fibrosis to be able to participate and have a voice in this effort. And we know that greater diversity, equity, and inclusion will result in a more effective and productive foundation and greater and faster progress against this disease. We are currently in the process of building out a comprehensive DEI program for the foundation. So after gathering extensive input from the community, we arrived at 3 fundamental strategic goals. These 3 goals summarize what the PFF will be focused on over the next 3 years and answer the question, what does the PFF do? I will now discuss initiatives supporting each of these goals. We know that accelerating treatments and cures through research is what motivates many people with PF and their families to become actively involved with PFF. And we have several important initiatives we're pursuing to achieve this goal. First, we want to encourage and leverage the use of the PFF registry and care center network. Truly great work has been done to build these 2 research assets over the past 5 years, and now we must actively promote their use to answer key research questions. As I mentioned before, nearly 40 studies are currently underway utilizing the registry, but this is just the beginning. Second, we want to work with the US Food and Drug Administration over the next few years to enable faster and more efficient clinical trials of new PF drugs. PF patients need more treatment options, and the process needs to move more quickly. Third, we want to help increase the number of PF patients participating in clinical trials. Enrolling enough patients in clinical trials is a challenge across all diseases, so this must be a major priority. The good news is there's a strong pipeline of potential new treatments for PF, but we need enough patients to enroll in all the pending trials. Fourth, we plan to continue to build our government advocacy efforts with a particular emphasis on ensuring that PF research funding is growing at the National Institutes of Health and the Department of Defense. Fifth, we want to further expand our PFF Scholars Program, which provides critical support and mentorship to more junior researchers with the goal of making them successful in obtaining larger grants and building careers in PF research. And finally, we plan to make a concerted effort to encourage and coordinate research collaboration among the many sites within our care center network. Our second strategic pillar is improvement of care for all patients with pulmonary fibrosis. A major initiative in this plan, which is also part of our current plan, is to reduce the time it takes for patients to receive an accurate, definitive diagnosis. Diagnosing PF is inherently complex, but we can and must do better. We hear from so many families who have been extremely frustrated by the length and confusion of the diagnostic journey. Currently, it can still take 3 to 5 years to be diagnosed. This is simply unacceptable, so the PFF will redouble its efforts on this issue, including in partnership with others in the community. Another major initiative is to identify where the best care is being provided, and then establish best practices and standards of care that can be shared across the community. We also want to look at adding new members of the care center network in order to make the expertise and services of PFF centers available to more people in more parts of the country. And finally, we will work collaboratively with others in the pulmonary community to improve access to supplemental oxygen within the Medicare program and to improve access to pulmonary rehabilitation. We will continue to work with other organizations such as the American Thoracic Society, CHEST, the American Association of Respiratory Therapists, the COPD Foundation, and others on both of these important initiatives. Our third major strategic goal is to continue to provide reliable, high-quality patient support and education. We are proud of the Foundation's work in these two areas since its founding in 2000. And we want to maintain our high standards and continue to expand our offerings for patients, caregivers, and families. During the stakeholder discussions that we had with patients and caregivers in particular, the need for a renewed focus on the newly diagnosed was identified as extremely important. So the PFF plans to develop an orientation program for patients, caregivers, and families who are new to the PF journey and to the PFF. This new effort will introduce patients to our offerings via guided content modules based on their interests and needs and in a useful sequence. And we will increase our engagement with care center network sites and community pulmonologists to make them more aware of PFF resources for their patients. Second, we will expand our efforts to make PFF educational and support resources available to more diverse and underserved communities. We have made strides in this area recently, but we have a lot more work to do. And finally, as already alluded to, we will make a much more concerted effort to ensure that the care center network sites and community pulmonology practices are aware of our offerings. Part of this effort will center on making sure that those sites and offices receive our educational and support materials so they are then available for newly diagnosed patients. So it's clear that we're doing a lot, and that's because there's so much work to be done for these patients. But we cannot do everything and do it well. So we decided to identify a few things we deem worth doing, but that we simply don't have the capacity to address at the present time. For example, we will continue our efforts to get the word out about PF via social media and more traditional media outlets. What we won't be able to do is conduct large campaigns aimed at educating the general public. The resources needed to do this effectively are simply beyond our scope at the present time. Similarly, even though it's a need, we will not be able to invest a lot in educating primary care providers, which we realize is an issue. Instead, our focus will be on educating community pulmonologists, which itself is a very large undertaking. And finally, we have had numerous discussions over time that continue during this process about establishing a PFF clinical trials network, utilizing all or part of the care center network sites. Those discussions are ongoing, but we do not have a specific initiative scoped out in this plan. As mentioned earlier, I wanted to focus now on a couple of organizational issues. As I mentioned earlier, the PFF is committed strongly to diversity, equity, and inclusion in pursuit of our mission, and we are currently developing an action plan. Areas of focus will include broadening board and staff diversity, expanding our support and education outreach, and conducting a study of PF care access in Black and Latino communities. Regarding our fundraising efforts, achieving our goals in this plan will obviously not be possible without securing the needed financial resources. While PFF's revenues have grown significantly in recent years, we will need to raise even more funds to maintain momentum in improving the lives of patients. So our goal for the next 3 years is to increase our overall revenues by 10% per year over the following programs: individual giving, including major donations; planned giving, mainly estate gifts; events such as our walk program and Broadway Belts event in New York City; and additional partnerships with industry. In closing, as I said earlier, we envision a world without pulmonary fibrosis. We dream of the day when we can declare victory over this disease and close our doors forever. As we move toward this vision of the future, we welcome the opportunity to work with the entire PF community to improve the lives of patients. This laser-like focus on patients will continue to drive everything we do. There has never been a more hopeful time in this effort. There is unprecedented momentum carrying this field forward that we must take advantage of right now. Together, we can make this vision a reality and make the world a better place. Thank you so much for your support of this noble endeavor. It's now my pleasure to introduce PFF's new Chief Medical Officer, Dr. Joe Lasky. Joe has served the PFF and the community in a significant volunteer capacity for over 10 years as a member of the Medical Advisory Board and Medical and Scientific Advisory Committee, Vice Chair of the Research Review Committee, and Co-Chair of the PFF Summit in 2019. We've kept Joe very busy. In addition, Joe has shared his extensive professional expertise through his involvement with the PFF registry and the Precisions trial that I mentioned. He has dedicated his career of more than 30 years to caring for patients with PF and studying the effects of this disease. Joe is a professor and pulmonary critical care section chief at Tulane University Medical School. We are very fortunate to have him on the PFF team. Joe, over to you.
Thanks for that kind introduction, Bill. It's a privilege to serve as the Chief Medical Officer for the Pulmonary Fibrosis Foundation, and they have the opportunity to work with the exceptional PFF Medical Team, which you'll be meeting shortly, as well as the staff and the community as a whole. This is going to be an informative and I hope inspiring session, so I'm very pleased that you've joined us for this. I'd like to take a moment to recognize our major PFF Summit 2021 sponsors. Without them, we couldn't put on such a program such as this. At the diamond level is Boehringer Ingelheim. Gold sponsors include Chiesi, Fibrogen, Galecto Biotech, Genentech, Horizons Therapeutics, Pliant Therapeutics, the Three Lakes Foundation, and United Therapeutics. Thank you to our generous sponsors for the support for the PFF and this Summit 2021. Now I'm going to introduce you to the PFF Medical Team, and they include Dr. Amy Hajari-Case, who is the Senior Medical Advisor for Education and Awareness. Dr. Kevin Flaherty is in the Steering Committee Chair for the PFF Registry. Dr. Joyce Lee, she's the Senior Medical Advisor for Research and Healthcare Quality. And also for Dr. Sonia Donhoff, who is a Senior Medical Advisor for the PFF Care Center Network. She is unable to join us today. They are passionate, experienced, and a dedicated group of pulmonologists who have already added significantly to the PFF's research, education, and outreach efforts. This session will be informal and conversational. We wish we could be together in person with you, but we hope we'll get a chance for you to know us and the medical team a little bit better tonight. I want to kick off the conversation by asking each of my colleagues to introduce themselves with their name and their home institution.
I'll go first. Hi, everyone. I'm Amy Hajari-Case. I'm in Atlanta, Georgia at Piedmont Healthcare.
Right. My name's Kevin Flaherty. I'm a professor of medicine at the University of Michigan in Ann Arbor, Michigan.
And I'm Joyce Lee. I'm at the University of Colorado.
Wonderful. So we're spread throughout the country. Now, my first question to you all is for people to get to know you is how did you get interested in pulmonary fibrosis and the PFF?
You should say
Yeah.
somebody's name.
Let's go in alphabetical order. So I'll be honest, Joe, when I started my pulmonary fellowship, I'm not sure I knew anything about pulmonary fibrosis. But it was working with the faculty here and the mentors here, and then really the IPF net that was doing early trials in pulmonary fibrosis, and I had the opportunity as a very junior person to work with thought leaders in the field who really helped me, took me under their wing, and allowed me to be part of these projects, and that excitement and that mentorship is what really got me involved in pulmonary fibrosis.
Amy? Or Joyce, I'm sorry.
Sorry, I was going to say I have a similar story. I actually knew very little about pulmonary fibrosis and interstitial lung disease at the start of my fellowship. And I honestly thought I was going to be doing bench research in ARDS and acute lung injury. And when I started fellowship, I realized that wasn't quite my path. And I had many weeks on consult service with Hal Collard at San Francisco General Hospital, and he told me about these groups of diseases and really inspired me and really led me towards this path. So for me, it's a story of mentorship that led to the world of pulmonary fibrosis.
I think it says a lot about our medical community that many of us get here by meeting up with good mentors who are looking for people to shepherd into this field and carry on this work. I have a similar story. So I through residency, thought I kind of knew I wanted to do pulmonary and critical care, but I thought I was going to be a transplant doctor. And as a first-year fellow, I was paired in clinic with Joao de Andrade, who is my mentor to this day. And I guess the rest is history. Just introduced to the field. He introduced me to clinical research, which I didn't know anything about as a trainee, and just led me to this on this career path, and has, as I said, been a wonderful mentor even today.
So Joe, I think it's fair for us to ask you how you got interested in pulmonary fibrosis as well.
Yeah, well, and it might be more of a Forrest Gump kind of story if you've seen the movie, but that's okay. Certainly, meant many people along the way. I remember very fondly Ed Rosenow at the Mayo Clinic, who was extraordinarily supportive and a walking encyclopedia. And certainly he had an interest in interstitial lung disease and drug-induced lung diseases at the time. Unfortunately, when I went to Duke, I had the opportunity to work with Arnold Brody. I wanted to be a physician scientist, and Arnie let me in his lab, even though I don't think I knew what end of the pipette went into the solution. He took the time to give me the opportunities there. Kevin and Joyce, how about mentors for you along the way? You mentioned a few.
Yeah, well, my primary mentor and my academic father is Fernando Martinez. And from the very beginning, he just was instrumental in encouraging me, opening doors, introducing me to other colleagues. But very quickly, it became a large team. And I think one of the things that I love about this community that's kept me involved is it is very collaborative. It is groups of people that want to work together to find cures for these diseases. So Fernando is my primary mentor, but I would use the remaining 20 minutes if I tried to list the names of everyone who has provided leadership and guidance to me along the way. Lord knows I needed a lot of it. So there's a lot of people out there that I'm grateful for. Joyce?
Yeah, I mean, Hal has been my primary mentor, and I continue to bother him with mentorship related questions, and Talmage as well have really been the reason why I went into this area of research. And like Kevin said, so many other amazing people along the way. That is one of the things that I enjoy most about this community, is the really fantastic and smart and knowledgeable and people who share their time and wisdom with people like myself. And so I couldn't be more grateful for the community that I've come to love.
Wonderful, thank you. The next three questions I'm going to ask are, I'm going to preface it with a quote, and the quote wasn't originally made towards pulmonary fibrosis. It was made towards another very important movement, and it was the Reverend Martin Luther King. And what he said was, we ain't what we ought to be, and we ain't what we want to be. We ain't what we gotta be, but thank God we ain't what we was. And so I think we have made a lot of progress over the past decades in regard to treatment and care of patients with pulmonary fibrosis. And I think we've got a long way to go. But the question I'm going to ask first is, what are some of the most significant advances in PF that have occurred during your career? Amy?
Oh gosh, it feels like a different world than the vague recollection of the first year of medical school, where I heard all the alphabet soup, but it didn't really matter because you couldn't do anything about any of it. Because it so does matter. I learned that along the way, that even without the things that have developed in my career, all the supportive care things that we had back then when I was in medical school still completely matter. But I think probably the biggest development was in 2014 when we had 2 antifibrotic agents approved by the FDA for the treatment of IPF. When I first came out of fellowship, there were still a lot of people using prednisone, azathioprine, and N-acetylcysteine. That was before the Panther study. So it's been a real change in approach, particularly to IPF, and now in progressive fibrotic diseases as well. Kevin, what about you?
Yeah, I would say the same. I think the first breakthrough, which we were disappointed about the Panther study being negative, but it really helped us stop harming the community. And so I think that was critically important. And then, as you said, the excitement of actually having 2 antifibrotics in 2014 for idiopathic pulmonary fibrosis, and then realizing now and I think trying to understand, other types of fibrosis through, progressive fibrotic lung diseases. The antifibrotics may work in diseases, or do work in diseases that have progressive fibrosis as a phenotype beyond IPF. Joyce?
I don't know that I can add very much. My answer when I heard the question was the Panther trial and the FDA approval of our 2 antifibrotics, I think, have been the key things in the past several years.
Yeah, I think the other thing, and I think Bill highlighted this, that we've got a long way to go, but how we've evolved in terms of approach to diagnosis. It's still critically important, and it takes too long and it's cumbersome. But I remember starting off, as a fellow and junior faculty, where your goal was, biopsying almost everyone. And now we have a better understanding of HRCT. I think we're trying to understand, genomics and other biomarkers that may help us. I think that's where we're going to hopefully get to in the future. But I think we've made progress in our understanding of diagnosis. We need to make a lot more progress in the process of diagnosis to make it much more efficient. Joe, what are your thoughts?
Well, you've said much already, but I can think of 3 other things, and I can go back a little farther than you 3.
Not that much.
On the career. So, one of them is, our pathology colleagues, Anna Louise Katzenstein and Tom Colby and Jeff Myers, helping us understand what we were looking at under the microscope, and that things might be a little bit different, and helping us classify things a little better. That goes way back. More recently, our radiology colleagues, the Fleischner Foundation, is helping us understand and interpret CAT scans better. And that's really helping us manage patients differently than we might have 5 or 10 years ago, because we're understanding these patterns that they're so much better than recognizing than we were back at that time. And I think also, a lot of work has been done by societies around the world. The American Thoracic Society, the European Respiratory Society, Asian Society, getting together and helping us with some guidelines on how to diagnose and manage too. And that's been a really large effort that they have put forward. I think that's really helping us. So I'd add that to what you had already mentioned. Okay. So my next question is, are there some major or minor initiatives or breakthroughs for pulmonary fibrosis diagnosis and treatment that are just around the corner? What's new? What's got you excited? Let's start with Joyce this time.
I think the question is, I think part of the excitement is I don't know. In terms of therapeutic breakthroughs, there's, exciting clinical trials going on, trying to work to get those enrolled and move forward. And hopefully not just one, but more than one of those will be the next breakthrough in terms of therapeutic advances. I think in terms of diagnostics, research that's going on, trying to look at liquid biopsies. Can we find things in the blood of our patients that can tell us what the diagnosis is beyond having to do biopsies or other things that are more invasive? So to me, I think the science behind the therapeutics that are being studied and trying to figure better ways to predict prognosis, to make a diagnosis that are faster and less invasive, that's what I hope we'll be able to see over the next few years. Joyce?
Yeah, what gets me really excited about the science right now, and I don't know if it's right around the corner, so that corner might be really large, is the idea of prevention. And so I think we're learning a lot about risk factors for development of disease and linking things like interstitial lung abnormalities to genetics and certain biomarkers that can be picked up early. And I think if we can prevent patients from developing severe fibrosis, the time that we usually see patients at an ILD clinic or ILD center, I think would be amazing. And I think we are at the cusp of science to be able to really put those things together, identify patients early through blood tests, genetics, or CT scans, and then test early intervention so that we can prevent the devastating consequences of pulmonary fibrosis. And that's what I'm really excited about.
Amy?
I think that would be meeting the dreaming of a world without pulmonary fibrosis right there. I think we'd all be put out of jobs and it would be wonderful. I do think that corner is a big one, but it's going to be amazing when we get there. I don't have any insider knowledge, so I'll just say the same things that they said.
I might add that I think that there's a great deal of work that's been done in basic science with great ideas of medications that might work. I think there's been movement forward with trying to repurpose drugs, which shortens the time to getting a effective drug approved for the treatment of pulmonary fibrosis. I also think that we're getting smarter about trial design, and we've learned some things from COVID, and unfortunately the hard way, to maybe do some adaptive trial designs, which would accelerate getting some answers and moving some of these candidate drugs onto the phase 3 trials more rapidly. So I'm excited to see some of those things occurring in the field of pulmonary fibrosis. So my last question then is, what's needed now to move us closer to our goal of establishing better treatment for pulmonary fibrosis? What should we be emphasizing?
So I'll go first. I think the obvious answer here is that we need to be able to get through these clinical trials that are testing new therapies and find out if they work or not. And that takes the altruism of the people in our community to participate in those things. It also takes our own organizations to put the effort and the manpower and the brains behind getting it done too. I would also like to say that I think that we're getting to a point where it's not just IPF studies that are out there. So I think we're seeing more non-IPF pulmonary fibrosis or interstitial lung disease research that's going on. And I think that's really important because some of our community has IPF, many in our community have IPF, many of them don't. And addressing the unmet needs in that part of our community is going to be really important, and understanding how their disease behaves like those in IPF so that they can possibly be studied together or in, you know, in parallel studies and things like that. It's going to be just so important for our entire community. I think it'll help us know more about all of the diseases that we deal with. Joyce, what do you think?
Yeah, I couldn't agree more about that. I would add that I think the things that we need or continue to need is investment in our future scientists and clinicians, right? So COVID has really, impacted a lot of our early faculty and fellows in disproportionate ways. And I think that what we need now is really some reinvestment in those people that are going to continue to carry the torch moving forward. And that would be one area that I would add in addition to yours, Amy. How about you, Kevin?
Yeah, so trying to build on those, which I completely agree with. I'll borrow and probably paraphrase, but the words of Andy Limper that we need an army for pulmonary fibrosis. And I think the efforts of the foundation in terms of building this community, both at the academic centers, through the care center networks, but also now, with getting ready to launch the community registry where people can engage with the foundation, participate in research. I think the untapped potential of that, of actually understanding what fibrosis looks like outside of the walls of an academic medical center, can be incredible. And I really am hopeful that will really help us move the needle forward faster and probably in ways that we've never really thought about or imagined. So I'm hopeful for that aspect of our near future.
And I would add that something that's really needed is our patients who have pulmonary fibrosis to volunteer and get involved in these clinical trials. We have many clinical trials to get involved in, and we're not going to have the answers without your support of getting involved in the trials. That's why we have the current drugs that we do have available for the treatment of pulmonary fibrosis, because somebody before you got involved, was willing to get involved in a clinical trial. So before we conclude this portion of this conference, is there something else that you would like to add at this time?
There's just too much to say.
Okay. Oh, I just thought I'd throw it out there in case I forgot to say something. So thank you so much, Dr.
No, I guess what I would
Case.
say, Joe, is welcome. And we are excited that you are the CMO of the foundation and look forward to your leadership and creativity moving forward. So thank you for stepping into this role.
Much obliged. Thank you. Thank you. And thank you so much, Dr. Jari Case, Dr. Flaherty, Dr. Lee, and Dr. Donoff, who unfortunately couldn't be with us today. So at this time, I'd like to make a transition and thank our wonderful speakers for sparking such insightful discussion. Now it's with great excitement, really, that I welcome a special guest to our virtual stage today. Bernie Williams is a Yankee legend and Latin Grammy nominated musician who has dedicated his time to raising awareness for idiopathic pulmonary fibrosis, the disease that claimed his father's life in 2001. Bernie's been a tireless advocate for IPF awareness, and his instrumental track, Para Don Berna, has become widely known as a tribute to his late father's IPF journey. Let's listen to that track now. I think it's going to be a little difficult for me to compose myself after hearing that touching music. So please join me in welcoming Bernie Williams.
Well, thank you so much. Thank you. Thank you for the introduction. And I have been listening to you guys speak, and I've been so taken by it. I know you guys are doctors and you're kind of playing it cool, but I could hear the excitement in your voices, you know, and you know, I only think about the fact that, you know, while you're talking in medical terms and things that it will take me years for me to understand, I know that all that you're doing is affecting moms and dads and brothers and sisters and people that have families. So on behalf of all of them, I would like to say thank you. Thank you for the foundation, and thank you for all of you doctors doing this great work. It's just amazing to be a part of.
We're so happy to have you here, Bernie. And we're even happier to take this opportunity to discuss your latest initiative that you're leading to help bring awareness to pulmonary fibrosis, a disease that's close to home for you. Could you tell us a little bit about the Breathless Ballot Challenge?
Yes, absolutely. I have been partnering with the Boehringer Ingelheim since 2017 in this effort to raise awareness for IPF and his recognizable symptom of breathlessness through a campaign aptly called Breathless. We have been working since 2017, and it had taken me through all these places all over the country, telling my story about how idiopathic pulmonary fibrosis profoundly affected the life of my family through the passing of my dad in 2001. And I wanted to honor him by composing this tune, Para Lumberna, when he passed away. Just telling my story sort of led me to create this idea. That and actually the fact that I couldn't travel anymore because of COVID. So we figured out that we sort of came up with this concept of the Breathless Ballot Challenge, in which we were encouraging people to honor their heroes, as I honored mine by composing this instrumental tune, just putting lyrics to the tune. It was just a great project that we got involved in. We have over 70 lyric submissions, and all of them, each one of them were so hard and so heartfelt. It was such a hard job to pick the winner. We had a celebrity panel, myself included, and a lot of people included, to pick the winner. We finally picked up David DePino as the winner of our lyrics contest. And it was just an amazing thing to see him, and the fact that, we sort of told him and he was so excited about it. So with that said, we took the lyrics and the song and we were able to record it with a very prominent celebrity American Idol singer, vocalist. And I am not at liberty to discuss right now who that person is, but we are launching the tune with the new lyrics and actually the vocalist at a later time in the next couple of months. So please be tuned and you'll keep an eye for that.
Such a beautiful way to honor your father and also to care for people within the pulmonary fibrosis community.
Yeah, and it was, to me, it has been very therapeutic. I did not have an opportunity to say my goodbyes to my dad because I was in the middle of a playing season with the Yankees. He passed away during the middle of the season. And as any good professional sports person, you would learn to compartmentalize all these feelings. Since 2001, I never really had an opportunity to face these feelings on a personal basis. And it was just by having the blessing of being in this campaign that has really made me revisit all these emotions. And I've been dedicating a good chunk of my life these past couple of years to try to bring awareness to idiopathic pulmonary fibrosis, because I think that that's what my dad would want me to do. And I am paying tribute to his life and everything that he did for me by helping this being in this great process. And again, I wanted to thank, the foundation and all the doctors and the medical staff that really take care of these people on a daily basis and are coming out with new ways to address this devastating disease. So thank you from the bottom of my heart.
Well, based on what we just heard, I can say that you're still knocking the ball out of the park. So the future of the PF community is brightened by people like you who are dedicated to drawing awareness and raising support for all those who are impacted by this difficult disease. Thank you,
Thank
and thank you all for attending.
Thank you.